Hi, this is Julie Pringle and my PowerPoint presentation for personal and social ethics. Please open your PowerPoint and follow along. The three Bible verses that reflect my understanding of Christian ethics the most are Proverbs 22:6, Romans 13:8 through 10, and Matthew 7:12. Proverbs 22:6 encourages us to instill Christian ethics in our children at a very young age so that they will grow up knowing right from wrong and treating each other the way that favors God. If these values are instilled early on, they will follow them through life. Even if they stray or falter, this lesson will always be in the back of their mind. Romans 13:7 through 10 gives us a clear outline of the ethical behavior that is expected of all God's children. Matthew 7:12, also known as the Golden Rule, instructs us to treat others as we want to be treated. And although this saying is attributed to Jesus, most other religions use some form of this as an ethical guideline as well. This course raised my awareness of several ethical issues, but the ones that stand out the most are end-of-life decisions, reproductive technologies, and the death penalty. All of these issues raise good points on both sides of the debate. The first issue that I found interesting is euthanasia. This issue has caused a lot of public uproar over the years, and Dr. Kevorkian was a physician who contributed greatly to this debate. He felt that people should not suffer needlessly when approaching death and performed several mercy killings to patients who were suffering from the pain associated with their disease. Many patients under his care felt that the decision should be left up to them, and this is a very ethical, egoistic value system. Ethical egoists feel that any action that is in their best interest is the moral one. The other type of end-of-life assistance is done by withholding nutritional support. In this situation, nutrition and other treatments are withheld from the patient, allowing the disease itself to take its normal course. There have been many cases like this, and I agree that this is an ethical way of dealing with the ultimate death of a person. Many people, on the other hand, feel that only God has the right to take a life. Corinthians 1:3-16 says, "Don't you know that you yourselves are God's temple, and that God's Spirit dwells in your midst? If anyone destroys God's temple, God will destroy that person, for God's temple is sacred, and you together are that temple." Not only is there a religious component to this topic, the Hippocratic oath that all physicians take says they will do no harm, and this includes participating in a patient's death by giving a deadly drug or other death-causing procedure. The next ethical issue that I found fascinating surrounds reproductive technologies. Infertility treatments are quite expensive and can cause financial hardships to many couples who are receiving these treatments. Another issue that comes up is the legal status of the implanted or frozen embryo. What happens to the embryos that do not get implanted, and when are they considered a human being? Karen Sinasu with the Center for Surrogate Parenting works with many couples facing this dilemma and admits that there is no criteria for disposal of embryos in the United States. Ultimately, this is up to the couple. There is also a high risk for multiple pregnancies, and that is another ethical issue surrounding reproductive technologies. Because of that issue, many physicians are now limiting the number of embryos that are implanted into the woman's uterus for that very reason. The most important consideration for couples seeking reproductive assistance is of a religious nature. Some religions see this technology as a way to manipulate nature and do not agree with it under any circumstance. Some religions are accepting of the procedures that only use the wife's egg and the human husband's sperm, while others see the invention of this technology as an ability that God gave us so that we can live more comfortably. I agree with those that see the ability to invent these types of things as a gift from God. The final issue that I picked was the death penalty. People have fought for years over the death penalty and whether or not it is an acceptable punishment. Arguments range from what to do with those criminals who have given their life to Christ to whether or not the Bible says that it is okay to kill. Pro-life activists argue that many prisoners have turned their lives over to Christ and that all life is valuable. Carla Brown was sentenced to the death penalty for brutally murdering 2 people. However, she turned her life around while she was in prison and became a minister to those people around her. People argued that she should be spared the death penalty due to her newly found religion. God gives us clear direction in the Ten Commandments. You shall not murder. This seems pretty clear, but on the other side of the fence, people who believe in the death penalty use the passages in the Bible that talk about for an eye. Genesis 9:6, for example. Others question whether or not a saved prisoner can actually be a productive member of society while serving a life term. What does it mean to turn your life over to Christ and not really have the opportunity to prove it? It is certainly easy to say this when you're not faced with the daily struggles outside of the prison walls. The death penalty raises some serious issues for me, and I'm still very conflicted about them. I don't agree with the death penalty for all cases. However, I think there are certain criminals that do deserve to live because of the details surrounding their crime. Those people that have killed in cold blood with no regard for human life whatsoever do not deserve a second chance. However, if there is any doubt at all about the crime itself, I would vote for an appropriate term over the death penalty. There is no doubt in my mind that Austin Sigg and James Holmes should have the death penalty, and I also think that just because a person finds religion, the initial ruling should not be changed. Just as Ray 2009 states, the responsibility of the state is to punish criminals, not forgive them. My case study is based on a friend of mine who is 26 years old and has been married for 2 years and has had trouble conceiving. She desperately wants a child and has been taking fertility medication to help produce eggs. Unfortunately, one of the side effects is ovarian cysts. This month, the doctors discovered that she has a large cyst on her ovary, and because of this, they have told her to discontinue the medication for a month and see if it goes away. She is devastated that she now has to wait another month at the earliest to try and get pregnant. She has asked me what I think she should do. She's not sure if she should continue on with the medication, hoping that she does not get any more cysts, or if we should start looking at other options. I discussed her situation with her, encouraging her to pray about any decision that she makes. And we talked about the advancements in technology and that it may help her decision to research some of the other alternatives available. I asked her how she felt about the new technologies and what sort of things would limit her decision based on her values. I questioned her feelings about using donor eggs as she was unable to produce eggs on her own, and also about surrogacy. We also talked about the risks of proceeding with other options and of possibly losing the baby. I told her that that only her and her husband could make the final decision, but that I would support her no matter what. When I'm faced with problems like this, my ethical decision-making process starts with taking time to process the issue. In the past, I've jumped right in and ended up making the wrong decision because I didn't take the time to think about it. Once I've evaluated it and taken the time, I look toward the end goal. What am I trying to do? Is it worth my while, and what benefit will it have for me or my family? I gather as much information as I can about the issue, and I talk to others that I trust to get their opinions. I then look at my options and whether or not there are any obstacles related to those options. Before I make my final decision, I pray about it and try to think about what Jesus would do in this situation. I know that it will not always handle every situation exactly the way that He wants me to, but I can feel good about the decisions I make if I take these steps and ask for guidance. Thank you for your time today.